Hello everyone. In this video, we are going to continue the discussion on the general introduction of the diagnostics. In this video, we're going to talk about the rationales of Chinese medicine diagnostics. So from the study, we actually want to understand what's the reason that we can conclude the cause of the disease. From the symptoms and signs, and also we can conclude the pattern from the symptoms and signs. How does it work? There are three features of the rationales of the diagnostics. Here you can see we got four features. We're going to go through one by one, but when we go to the fourth, you will see the fourth feature, deducing internal pathological changes from reactions to external pathogenic factors. This is very similar to the first features, judging the internal from expression of the external. So we are actually considered the three features of the rationales. We're going to discuss one by one what does this mean. Firstly, judging the internal from its expression from the external. This theory is actually from very similar to the black box theory. The black box theory was developed in a few hundred years. It was first introduced in engineering. So in the engineering, especially for the electrical engineering, they want to know from the black box what's inside there, what's in the black box. There are two ways to understand the black box. One is to open the black box so you can see how the connection works inside the black box. But sometimes we cannot open everything. So from the engineering, they also have the theories. How does it work? They use some inputs. They put the inputs on the black box, and then they check the outputs. Then they try to understand the connections from the inputs and outputs. They try to understand what's in between. So this is very similar to our theory. In Chinese medicine, we mostly use this kind of theories to diagnose. Because if you want to open the black box, this is very similar from the anatomy. So we want to understand our human body from the anatomy. That's initially how we understand our human body. We do from the anatomy, we see the organs, and now as the technology develops, we see the cells. Even more, we see the structures from the cells from the microscope. We're going to study it further and further. This route, this pathway, is the pathway to open the black box to see what's inside. So we try to open our human body to study what's inside. We try to study the physical heart of our body. Then we see the artery there. We study the heart muscles. We study what's in the muscles, what's in the cells. So that's one way to study the black box. The other way is we don't open the black box because sometimes we cannot open the black box. For instance, from the picture at the bottom on the right side, the brain. The brain from anatomy, we can study the brain different function area, different location of the brain controls different function. From the anatomy, from the physiology, we know, we study from there, that's the information from there, we know some parts of the brain control certain parts of our human body. But from the anatomy, do you see which parts can control which function? Obviously, the answer is no. We cannot see certain parts, the function of certain parts. So what we can do, how are we going to study the function of the brain? How are we going to study the area? So we can use some inputs to the brain. For instance, we're going to use the electricity to stimulate some parts of the brain, and then we will see which part of the body going to move, or there's some reactions from certain parts of the body. Also, we can see for stroke patient, they got some injuries on certain parts of the brain, and then certain function the patient lose. So from here, we can conclude that from the symptoms and the damage from the brain, we can conclude the relationship between the brain and the movements. That's from the black box, because not everything that we can see, we can see physically. So that's the judging internal from inspection of external. Let's also send the external from our human body. What's the external? It can be the body shape, it can be the tongue, it can be the face color, it also can be any kinds of symptoms and signs, such as the picture, the tongue here. You can see this tongue, you can see the color of the tongue, and one crack in the middle, and also the coating at the back of the tongue. When we see all these signs, we need to think about what happens to the internal organs. So that's how we use the 4 diagnostic method. And judging the internal from the external, we also, this is very similar to the environment. As you can see the rows here. Is this rose healthy? When we see from the rose, is it healthy or not? We don't actually cut the leaves and send to the lab. We don't actually cut some stem and send to the lab. We see from the leaves. Then from the leaves, you can see the flowers flowered well, the leaves well, so you can consume that this rose is healthy. But at the same time, we also see this area. You can see the leaves, there's some black spots there. So when you see these black spots, you need to be careful. That's the health of this rose. It might develop into worse situation. So that's very similar when we see from the patient. When we see the signs, the symptoms of the patient, when you see very mild external symptoms or signs, you need to be careful the developments of the disease. And the reason how we can use how we can connect the external with the internal organs. That's the theories we studied in the basic theories, because there are connections between the internal and external, such as the lung links to the skin, the heart linked to the tongue. So that's the orifice of the internal organs. So that's how we can see from internal, from the external to judge the internal. The second, knowing the overall condition from perception of the micro changes. What does it mean for this is in the environment, in the nature, the season changes from spring to summer, from summer to autumn, from autumn to winter, and from winter to the spring again. So it goes in this cycle. How do we know certain season is coming? For instance, how do you know the autumn is coming? Especially in Joburg, you can see even in autumn, the weather is not cold. The weather still can be hot, very similar to summer. So in summer, we are quite hot in Joburg, but in autumn, especially early autumn, we are still experiencing the hot weather. But how do you know the autumn is coming? You see from the leaves. If the tree start to fall, the leaves of the tree start to fall, then you will know that the autumn is coming. So you can see from very small changes, you can predict the big changes in the environment. From one falling leaves, you will see that the autumn of the season autumn is coming. That's the micro changes. Also from another rose I gave you here on the right side. This rose also flower well, as you can see the pink roses. They flower well. The leaves also green. So from here it's a kind of healthy rose. But when you see carefully, you can see this part. The part I marked there, the leaves still green, but the shape of the leaves become round. You can watch the previous slide, the leaves of a rose. They're supposed to be longer, not round shape. It's supposed to be this shape, this kind of shape, but not round. So if the leaves of the rose become round, it can indicate that this rose is a lack of fertilizer. So these very small changes, you need to understand what happens to the plants, same as us. The minor changes on our tongue, very small changes from your pulse, we need to understand what happens to our health, what happens to our internal organs. Why in some area of your body, when we press, you feel pain? What does this pain reflect to your health? So these are all micro changes, very small changes. We need to gather the small changes and conclude the causes to understand the status of your health. So this is the diagnostics. That's why we use the 4 diagnostic methods of observation, smelling, inquiry, and palpation. These methods try to find small changes, and from these small changes, we want to understand the overall health of our human body. The last one, detecting abnormalities by comparing to the normal healthy states. So for this feature, we actually describe that in order to understand the abnormal, we need to study the normal. So that's why to understand the pathology, pathology, we need to study the physiology. We need to study the healthy state of our health to find the abnormal. So same as the orchids on the side, you need to know that a healthy orchid, what the leaves looks like, what the flower looks like. Then you will understand when the leaves become withered or when the color of the leaf change to yellow. It means it's unhealthy. So these three features are the principles or the laws we use in diagnostics. How we going to understand our health? We use these kinds of principles. The last one, deducing internal pathological changes from reactions to external pathogenic factors. This is very similar to the first one. We want to understand what happens to the body when we study the etiology in the basic theories. So I ask that we cannot see the wind, we cannot see the coldness. How do you know the body is attacked by the wind or the body is attacked by the coldness? That's from the symptoms, from the external, the symptoms we can see the reaction of the body. What kind of reaction is related to what kinds of pathogenic factors, such as the coldness in the fingers, in the feet, are related to the coldness. So in this situation, the patient may suffer from coldness, and the coldness, you will know that the coldness may affect the yang qi in the body, especially for the spleen and kidney. So from this situation, we actually see the reaction. We see the reaction of the body, and then from the reaction, we're going to think about what's the cause and what's the development chain of this cause. So that's how we're going to use these methods in our diagnostics. And from diagnostics, the four methods, because of especially for the tongue diagnosis, there's a lot of information in the tongue diagnosis. So tongue diagnosis, we're going to discuss separately from the observation. The tongue diagnosis is included in the observation or inspection, but because the tongue diagnosis has has a lot of information, so we're going to discuss separately. And also from the palpation. The palpation includes the palpation on the skin, on the abdomen areas, but also from the pulse. The pulse taking. The pulse taking is considered as one method of the palpation. We're also going to discuss separately. The principles of the Chinese medicine diagnostics. The first one, overview. We want to understand the overall health of the human body. Overall health, how do you know the overall health? theories of the concept of autism. The concept of autism, we need to understand the human health with the nature, with the location where they live, the environment, the emotion. So these are the overall health of the patient. That's also why when we see a patient, no matter what kinds of disease they came to us, when we see the patient, especially for the inquiry, when we ask the patient, we always ask the such as the feelings, coldness or hot, their diet, their bowel movements, or their sleeping, their emotions, their mental activities. You also see from the tongue and feel the pulse. We try to understand the family history, we try to understand the body constitution, the environment where they live, the climate where they live. So these are all overviews of the patient. When we see a patient, we need to understand all these backgrounds of the patient. This is the first principle we going to use in our diagnostics. The second is the combination of different diagnostic methods. The diagnostic method, observation, smelling and hearing, inspection, inquiry, and palpation. So these are four. Especially the most interesting diagnostic method is the palpation, especially from the pulse taking. Even in most countries, they don't have those kinds of the diagnostic method. So especially in the TV show, you will see that some movies, some episodes, they show the unique methods of the pulse taking. The patient come to the doctors, the patient didn't speak anything, and then the doctor only took the pulse, and the doctor can tell the patient what was the problem with the patient. So that's from the movie, and that's also in reality. There are also some people they misunderstood that Chinese medicine we can diagnose from the pulse only. That's why some patients when they came to us, they don't speak anything. They just put their hand out to feel the pulse. They want you to predict what happened to them. In this situation, you need to explain that our treatment principles, a combination of different diagnostic methods. So actually, these are four diagnostic methods. We use them in combination. We don't only use one or two. Because if you use one, it's very easy to have mistake, especially when we study the pathogenesis, the true and false. You still remember the true cold, false heat, or true heat, false cold, or true excess, false deficiency, true deficiency, false excess. So if the patient presents with true and false patterns, if you only use one diagnostic method, it's very easy to make a mistake. That's because if you, for instance, from the pulse, you feel that the pulse is very slow and weak, and then you think about it, the patient may be deficiency, maybe the coldness. But in the meantime, the patient may be constipation, may have abdominal pain, and then in this situation, it didn't ask only from the pulse you predict that you say that the patient is in cold and deficiency condition. But when you ask them, when you use other diagnostic methods, you can find other signs that are conflict to your pulse results. If you find some conflicts from these diagnostic methods, we need to think about what's wrong there. Which one is true? Which one is false? Which one is the root cause? Which one is manifestation? So if you use only one diagnostic method, it's very easy to cause mistakes, misdiagnosis. So that's why when we train our skills, we also need to train 4 of them. The last principles of the Chinese method of the diagnostics is combination of disease differentiation and pattern differentiation. Although we focus on the pattern differentiation, especially when in our treatments, we more focus on the pattern differentiation. But in the meantime, we also need to understand the disease, because sometimes some disease have certain characteristics, such as the COVID-19. We have used COVID-19 quite a few times. That's because this disease is very typical. For COVID-19, if you understand the disease, you will know that the COVID-19 has some characteristics, and in the particular patient, you can differentiate the patterns on individuals. So in this situation, we need to combine the disease differentiation and the pattern differentiation. So in our diagnostics, in our treatments, in our daily practice, we don't say that we only differentiate the pattern, we don't care about what kinds of disease. We do actually care about the disease, because from the disease, we can understand what's the development trend of the disease, what's the prognosis of the disease, which is very important for the prevention. The prevention is very important. We don't wait until the patient have problems, then we differentiate the pattern. That's why it's very important to differentiate the disease as well. So in this slide, we're going to give you a very brief introduction of the development of the diagnostics. The diagnostics is actually in the 4 classics. So in the 4 classics, it not only describe the theories, you also have the diagnostic methods, the principles of diagnostics. That's why in 黄帝内经, it describes that we need to observe the mental activities, we need to observe the facial colors, we need to hear the voice, we need to distinguish different voices, we need to inquire, we need to take the pulse. So these are all different theories in 黄帝内经. And also in 黄帝内经, from the concepts of holism, it describes that in our diagnostics, we need to combine with the internal factors and external factors. So these are the initials of the diagnostics. And when you develop into 伤寒杂病论, we didn't write here. That's another classic. That's where the syndrome differentiation methods come from. It also describes the cause. The causes of the disease, how to categorize different causes of disease. And also in Nanjing, Nanjing is also another classics. So the four classics:南京《黄帝内经》、南京《神农本草经》and the 伤寒杂病论. In Nanjing, it described how talented the practitioner is from observation, from hearing, from inquiry, from the pulse taking. So if you can use one of these skills, and then you can be a talented doctor. If you can perform these skills well. So that's the description in the classics. And then later on, 脉经, 淳于意, he was a practitioner 2000 years ago. So that's the ages where he lived. Why we mentioned this doctor? That's because 淳于意, he proposed that we need to keep medical records. That's the first medical records were kept. The medical records at that time include the name, the physical checks, the symptoms, and prescriptions in the medical records. So our medical records were from Dr. Chun Yuyi. Later on, 脉经 is the earliest monograph on pulse science. So the pulse diagnosis, the theories. This one is the earliest monograph. 走后备急方, you see all these books we have mentioned quite a few times in the history of study. So if you don't remember any of them, you can go back to the history study, revise from there. In 走后备急方, he also described some diseases such as the diagnostics of smallpox. What's the symptoms? What's the treatments? What's the symptoms from the patient? What's the signs of the patient? 诸病源候论. That's another book that's the earliest monograph on diagnosis. In this book, many discuss about the causes of causes. What's from the symptoms and signs? What we can conclude from the internals? What happens to the human body? What happened to the individuals, and then they can have this kind of symptoms. So that's from the 诸病源候论. This is this monograph on diagnosis. The next books, 三因集医病症方论. So this is another book, the causes of disease. 点点经, the first monograph on tongue diagnosis. So as you can see from the classics, 2,500 years ago until 17th, 18th century, is the theories of diagnostics. It was actually keep developing. The last books, 锦岳全书, we're going to introduce here. That's because in this books, the author appealed 10 questions that we should ask the patient during our consultation. And these 10 questions That's still the questions that we are going to study in our inquiry. So for the next video, we are going to study the inquiry. We're going to study from these 10 questions. So if from a consultation in front of the patient, if you don't remember what to ask, if you remember these 10 questions, the 10 questions can help you to gather information, to gather the very important information from the patient. So that's the very brief development of the diagnostics. If you want to get more information, you can refer to the history, the lecture notes that we upload there on the blackboard. So the last part we're going to talk about is how to study diagnostics. First is familiar with the basic theories of Chinese medicine. So you need to be familiar with the theories that we have studied previously. The reason is because the diagnostic method is really very close related to the theories. The diagnostics is the bridge from the theory to clinical practice. So these two ends you need to understand. You need to understand and memorize the theories which we have studied previously, such as on yellow color, it indicates the heat. So these are the theories from the basic theories because yellow is related to the yang is related to the heat. So that's why you need to understand the theories, and then the theories will help you to analyze the clinical symptoms and signs. The second is practical training. So last week, some of you more practical training to make it more interesting. So the theories is the fundamental for the practical training because from the practical training, you need to understand why you are doing this, what this practical training can help you. That's from the theory. So for practical training, from the diagnostics, we're going to include more and more practical training, and we will see after the knockdown how can we perform the practical training, such as the observation, such as the tongue diagnosis. You're going to practice. The last one is training in the way of thinking. How to train the way of thinking. The most simple and easy and most practical way to read the cases. The case study. You're going to see from the case, so why the case described in this way, and what's the cause, what's the conclusion of the case, what's the treatment principles, and what's the treatment methods. So you need to read more case can help you to train the way of thinking. So from the theory study, the theory study is actually all purely theory. But as we study more and more, we actually include the practical. From the diagnostics, from acupuncture, we have a lot of practical. So from the practical, all what you need to do is to practice. Remember that no excellence can be acquired without constant practice. So, which means the only way to acquire excellence in the practice is constant practice. You need to practice more. Okay, so from the next video, we are going to introduce the inquiry, the first diagnostic method. Our courses in the diagnostics, we're going to study from the four diagnostic methods first, and then we're going to introduce the pattern differentiation. Okay, thank you guys.